Well, TK, thank you so much for continuing to speak with us throughout the show today. We've been talking about some of the shocking statistics when it comes to the Black maternal health rates, when it comes to the need for diversity in the healthcare field. But we want to end the show on actionable steps. What can we do to change the narrative and make sure that our Black mothers aren't dying, and make sure that we have more Black doctors and nurses in the healthcare field so we can make sure that we're providing the accurate and necessary care?
So there's a few things. One, I do want to give a shout out, if you will, to Prisma Health. Prisma Health has started a perinatal mood disorder clinic, and that is really a vital step into making sure that women have that support when they have children. And of course, it's not focused specifically on Black mothers, but Black mothers do have that opportunity to have that care. So that's a great opportunity there. Another thing is our colleges and our universities are trying to find ways to increase their access to educators, because when we have Black educators, we also know, just like in a hospital, if you get care by a Black physician or a Black nurse practitioner or a nurse, that you're more likely to get the care you need as a Black woman. The same goes for education. So when we create spaces for Black educators to get into the education field as nursing instructors and all of that, then that gives an opportunity for that as well. I would also say AHEC, I mentioned AHEC earlier in the show, but AHEC has an amazing program where they're really looking at how do we start you off early and how do we find initiatives to support that work. So there's...
What does AHEC stand for?
AHEC is the Allied Health Education Consortium. It is funded by the state.
Okay.
So they really look at what are the jobs that are in the healthcare space that need support, that need finances, that need really a breath of life breathed into them in a way. And nursing is one of them. South Carolina is slated to be in the top 10 for the nursing shortage in the next 5 years.
Wow.
And that also looks a lot like Black physicians. So when we create spaces for Black physicians to want to work and thrive here, and Black nurse practitioners to want to do the same, then we create space for people to be able to go to school and thus increase the outcomes for all of our patients that we serve.
To that Black little boy or Black little girl out there who's watching and they're like, I want to be in leadership like you when it comes to the healthcare field, and I want to be able to travel and make these impactful presentations, but they just don't know how to get started because maybe they're not around anyone who's ever been a doctor. What would your advice be to them?
So my advice will be twofold. One, if you don't know someone who looks like you, find someone in the occupation. Your school nurse, your someone at your church, somewhere in your community, and just ask them, what do you do? But the other converse of that, and the challenge I would give for the adults, is that you have to show up in these spaces. Give of your time, give of your talents, give of your treasure, and help these young people see a path forward in healthcare, and thus making sure that people are getting the best care possible. It's the only way to do it. We all have to chip in, and we all got to step in and do our part. And when we do that, more babies will survive and moms will survive as well.
Very important. And lastly, the South Carolina Nurses Association, you are the executive director. For resources or to learn more about the association or even how to support, how can people reach out?
So just reach out to us at www.scnurses.org. We are a 501c6 organization, so we do a lot of work for our constituent members, but we are doing a little bit of everything, grassroots all the way up to what's happening on the federal level. So anything we can do that supports nursing and supports our community at large, we're willing to do it.
All right, TK Curtis Pugh, thank you so much for coming on Awareness today. Really insightful information, and thank you for all that you're doing to have what I like to call real talk about these topics that may seem a little uncomfortable for people to have, but so important. All right, we're going to take a quick break. Much more awareness after this.